Good morning, everybody. My name is Henry. I'm here on behalf of Hoag Hospital. I just wanted to thank you for taking the time this Saturday morning to spend some time with us to learn about Hoag and Medicare benefits and some of the specific plan benefits. And just for the next hour here, just sit back, relax. Any of the literature that you need is on our YouTube channel on the links. So feel free to utilize that link to pull information that's discussed today. All right, well, I'm going to get started. I just want to share with you kind of what the agenda is today. One is I'm going to share a little bit about Hoag, and then Jeanette Paterka is going to give us an overview on Medicare, and then each Advantage plan is going to go over an overview of specific benefits and highlights of the benefits. So first, let me share a little bit about Hoag Hospital. Hoag has two campuses. They have one in Irvine and one in Newport Beach. We have 14 urgent care centers and 9 health centers throughout the county. Hoag's medical staff includes more than 1,700 physicians and represents 52 different specialties. Our 5 specialized institutes of excellence are neurosciences, cancer, heart and vascular, women's, and orthopedics. Hoag was designated a magnet hospital as part of the American Nurses Credentialing Center's Magnet Recognition Program. We're also the highest ranked hospital in Orange County by U.S. News and World Report for 2021 and 22. We're in your community. We're all throughout Orange County, and here's a list of some of our health centers. We're all the way from Aliso Viejo all the way through Tustin, and we're building new clinics on a regular basis in different locations throughout Orange County. Hoag in your community. Our urgent cares, very reflective of the list that I just had shown you previously. We're in Aliso Viejo, we're all the way through Tustin Ranch, and we're open 7 days a week just for unexpected illnesses and injuries. And we're proud to announce that we opened last year our Hoag Flywell Clinic at John Wayne Airport, Terminal B in pre-security. Access to primary care. How do you get to our primary care physicians? Well, first off, to get to the hospital, you access care through our primary care physician. You can do that in 2 ways, one through Hoag Medical Group and one through Hoag Physician Partners that we established in 2019. Hoag Medical Group comprises of primary urgent care and specialty physicians. We have over 100 doctors, primary care physicians, 21 primary care locations, and 13 urgent care locations. You can find our information online at hoagmedicalgroup.com. Next is Hoag Physician Partners. We have 10 primary care physicians, 350 plus specialists to service managed care patients, and you can find that information on hoaghealth.org/HPP. Hoag Medical Group. Let me give you a little summary here of our group. We have over 100 physicians with specialties in family medicine all the way through palliative medicine. Our locations are from Aliso Viejo, Costa Mesa, Fountain Valley, all the way through to Tustin, and even so far south as San Clemente. Some of our features and highlights are same-day sick appointments for established patients. We accept most major HMO, PPO, and Medicare insurance plans, and we really focus on the patient and unrushed personalized visits. Hoag Physician Partners. It's our Independent Physician Association, IPA. We have 10 primary care doctors. We have over 350 specialist physicians representing over 50 specialties. Recent additions include Orange Coast Women's Medical Group with over 20 OBGYN physicians in 6 locations. We have Hoag Gynecologic Oncology and Hoag Urologic Oncology. Access to the Hoag network including Hoag Health Centers and Hoag Urgent Care. Our customer service line, our phone number is 800-369-9247. These are the plans that are going to be presenting to you today, but before we go into the plan information, I'd like to introduce Jeanette Paterka. Jeanette's going to give you an overview of Medicare today.
Good morning. My name is Jeanette Paterka. I am a licensed insurance agent, and I am going to review Original Medicare with you today. So the The picture that you see here on the screen now is your Medicare card, or if you're not yet on Medicare, this will be the card that you'll be receiving. There's several things I want to point out with the card. First of all, when you enroll in any type of Medicare health plan, you want to transcribe the information from the card exactly as it is stated onto your enrollment form. So in this instance, if you left out the middle initial in John L. Smith, it could actually hold your application up. So you want to transcribe everything exactly as it's listed. You will see your Medicare number there. Medicare changed the Medicare identification numbers a couple of years ago. It used to be an individual's social security number, but now it's an alphanumeric number, so you will need this number. And then underneath that, you will see entitled to. These are the effective dates for your Part A hospital benefits for Medicare and your Part B benefits of Medicare. So you'll need to make sure when you enroll into a Medicare health plan where it says coverage start date, those dates both need to be completed for you to enroll into a plan. So what is Medicare? Medicare is health insurance for the following individuals. If you're 65 or older, or if you're under 65 and you have certain disabilities, if you've been deemed disabled by the Social Security Administration, if you have end-stage renal disease, which is you are on kidney dialysis, or if you have been diagnosed with Lou Gehrig's disease, you are potentially eligible for Medicare. So there's different parts of Medicare. Part A, I referred to Part A and B on the Medicare card. So Part A covers your hospital coverage. That's your skilled nursing, your facility. It's when you go into a facility or hospice care services. That's covered under your Part A of Medicare. Part B of Medicare covers the services that you receive. So your doctor's office visits, your lab work, your outpatient care, if you have, say, occupational therapy. So A and B covers the facility and then the services. And then Medicare added Part C a number of years after Medicare was originally started. Part C is what we call Medicare Advantage plans. You're going to hear them referred to as MA plans or MAPD. That stands for Medicare Advantage prescription drug, meaning it has the prescription drugs all baked into the plan. So it's the health and the prescription drug benefit. And then there's Part D of Medicare. So Part D was enacted in 2006. So individuals that are on original Medicare, or if they're on a Medicare supplement plan, which is a purchase plan we'll discuss a little bit later, they can opt into Part D and purchase a Part D standalone prescription drug plan. So there's different parts of Medicare and different types, different ways to obtain those benefits. So most individuals who are working and they work 40 quarters or a total of 10 years in their working life, they will automatically be enrolled into Part A of Medicare when they turn 65. But in certain situations, say if you were a stay-at-home spouse, say if you're a stay-at-home dad and your wife worked and paid into the system for 10 years and you had not done that, then you could actually draw your Part A benefits off of your spouse working for those 40 quarters or 10 years. So in that case, you do not have to pay any additional for Part A. Individuals that do not meet that 40 quarter or 10-year requirement also can contact Social Security, and you can pay a premium for the Part A benefits, and it's dependent upon how many quarters you actually have paid into the Medicare system. And then Part B of Medicare, all beneficiaries must pay a Part B premium. So if you opt into Medicare and you enroll in Part B, you have to have that in order to obtain Medicare benefits. I've had individuals or known individuals that canceled their Part B because they didn't understand it was really tied to their benefits. And then what happens if you decide not to pay your Part B premium, your Medicare benefits will be terminated. So you want to always pay your Part B premium. And then, as I mentioned, Part C, Medicare Advantage. What that is those are those MAPD plans, those Medicare Advantage prescription drug plans, mainly in this area. And those are offered by private insurance companies. Medicare has a contract with those companies. The ones you're going to hear the benefits today, SCAN, Blue Shield, Anthem, and United Healthcare, they all have a contract with Medicare, and they have to refile those benefits annually. And you'll hear we're in the open enrollment, the annual election period right now. They have to refile those benefits, and each year those benefits can change. And the premium can go from zero premium all the way up over $100 a month, depending on usually where you live in the part of the country. What you need to also know about Part C and Medicare Advantage plans is that they are filed by county. So if you live in Orange County and you decide to move up to San Luis Obispo County, you will actually need to enroll into a plan that is based in the new county of residence. And then Part D prescription drugs, as I mentioned, those companies also have a contract with Medicare, and there is a monthly premium for those Part D standalone plans. So in 2021, the Part B income-based premiums, this is a sliding scale. So remember, these are the numbers. This is the amount of money you need to pay every month. It's deducted out of your Social Security money that you receive. And if you're not yet drawing your Social Security money on a monthly basis, they will send you a quarterly statement that you need to pay the premium. But it's a sliding scale based on your adjusted gross income. So if you look at that second section there, $88,000 or less, that's for a single person, or if you're married filing jointly, it's $176,000 or less. So if your adjusted gross income is underneath those two numbers, you're going to pay in 2021 $148.50. And as you can see, going down the list of incomes, if we go all the way down to the bottom, if you're single and your adjusted gross income is $500,000 or less, or married couple $750,000 or less, you will have to pay $504.90 for your Part B premium. And this is per individual. So if you are a couple and you're both drawing your Medicare benefits, each individual must pay this amount. And then potentially there could be a Part D for your prescription drug premium as well. If you're in that lower income earners, the $88,000 or less, or the $176,000 if you're married or less, you will have no additional premium for Part D. But if you're one of those higher earner individuals or couples, you are also each going to have to pay an additional amount for your Part D prescription drugs. Okay, we're going to talk about enrollment periods. So what you need to remember is this slide right here is for an individual that's going to opt into their Medicare benefits when they turn 65. So if you're going to be turning 65 and you're new to Medicare, you have a 7-month window to enroll. This is the window where you want to contact Social Security, tell them that you want to basically activate your Medicare benefits. I would recommend, as you can see, month 4 there, that's your birthday month. So I would recommend 90 days out or 3 months prior contacting Social Security, letting them know that you want to opt into your Medicare benefits, and then they will send you in the mail the Medicare card. The reason I recommend doing that earlier than later is that sometimes there can be delays. So if you want your benefits to start on the month you turn 65, I would suggest month 1 or 2 at the latest, contacting Social Security and opting into those benefits. The benefits, no matter which month you are active, always go into effect the first of the month. So if you're month 4, say your birthday is on September 15th, and then you contact Medicare, say in month 2, and you say, I want my benefits to start, your Medicare card is going to state that your benefits start on September 1st of that particular year. The next enrollment period is the annual election period. They call it the AEP. That is where we are at right now. So if you're already on a Medicare plan, this is outside of your initial enrollment, which was the previous slide. If you're already on a plan, this is the time between October 15th and December 7th where you need to take a look at the plan that you're on, either be it an MAPD plan or a prescription drug plan. You need to take a look at that plan and determine if it's the same plan that you want to have for the next calendar year. So you can change or enroll in a prescription drug plan, you can change your Medicare Advantage plan, You can, if you're on a Medicare Advantage plan, you could return to original Medicare. So this is the time where you need to make a change. Approximately, if you're on Medicare on October 1st, you should have received a document that's called the Annual Notice of Change. This document outlines the existing plan you're on. So on October 1st, you would have received one of those. If you're on one of these Medicare Advantage or Part D plans, it'll go through your benefits, and then it will tell you, if you remain with the same company, what the changes are that will start the following year on January 1st. So that's the time where you need to be a really good consumer and advocate for yourself, and you need to decide if that's the direction you want to stay on that plan. Or if you decide you want to make a change, the enrollment application has to be submitted between October 15th and December 7th for that change to be, that move to possibly a different carrier or company to be effective on January 1st. So that's the annual election period. And then a couple years ago, Medicare gave us one additional time to make a change. So say if you make a change for January 1st and you go and you use your benefits with a new company, and for some reason you're just not satisfied with something that occurs, or you want to maybe move back to your old company, between January 1st and March 31st, you may make one additional change. So it's for individuals that are on a Medicare Advantage plan. They can switch to a different Medicare Advantage plan. You can drop your Medicare Advantage plan and return to original Medicare, and then also purchase a Part D plan. The way that it works is if you submit an application during the month, your new benefits are effective the first of the following month. So if the application is submitted on January 15th, it is going to be effective on February 1st. And then then at that point, you are locked in for the remainder of the year. So whatever you're on, starting October 1st through the remainder of the year, you will remain on that plan. But there are some instances where Medicare will allow you to make a change if you have a special reason. They call it a special election period. So this happens, as I mentioned earlier, the Medicare Advantage plans are filed by county. So say if you're on a plan in July and you move to San Luis Obispo, as I mentioned before, you can go ahead and during the year you can make that switch to a plan if you've moved from one county to another. So if you're moving out of your service area into a new service area, if you're eligible for a Medicare Special Needs Plan, you can move during the year to a new plan. And what that means when it says special needs, some chronic conditions, certain insurance companies have plans that are based around individuals having certain health conditions. So examples of that could be possibly if you're diabetic. Some companies have an insurance plan that's specific to individuals with diabetes, or if you have heart disease. If you have one of these conditions, or throughout the year if you're diagnosed with one, you can move on to a plan that is specific to that condition. The benefit of that is many times it'll cover maybe additional prescriptions that are specific to your diagnoses. And then full dual beneficiaries, you can move throughout the year if you are a full dual. And what that means is you have Medicare, which is the federal program, and Medi-Cal, which is the state program. So if they call them a Medi-Medi, you can move throughout the year. Or low-income subsidy, those are individuals that are on lower income, and we're going to talk about that a little bit more. But if you are qualify for what they call LIS, you can move. So prescription drug plans. You will see in the red where it says 2022 initial coverage limit. In this presentation, I have some information of 2021 and some for 2022, and that's because Social Security and Medicare don't always release all the new information at the same time. So what I'm showing you here is pertaining to 2022. So you always have a deductible, and this is the original Medicare standard baseline for prescription drugs. So you always have a deductible, and in the beginning of year, you're going to pay the first $480 of your prescriptions. So say if in January, February, it equals up to $480, you pay those 100%. And then what that does is that takes you into the initial coverage limit. So during the initial coverage limit, which is $4,430, what they do is they calculate out what your prescription drug cost is, the total. So in this example, if there's a $25 prescription, you have say a $5 copayment, and the insurance company pays $20, so that equals the $25. That $25 goes towards the $4,430. So you're going throughout the year, and you're getting for your prescriptions, and it's going towards that $4,430, which is the initial coverage limit. And then once you hit that limit, you go into what they call the coverage gap or the donut hole, which is basically a different way that you pay your prescriptions. So when you reach $4,430, then after that point, you're going to pay $25 for your generics and 25% for your name brands. And then you continue paying 25% until your total drug costs come to $7,050. And this is for 2022. And when you hit catastrophic coverage, which is when you've paid out of pocket yours and then what the prescription total cost is, $7,050, you're going to pay $395 for generics or $9.85 for all other drugs. Okay, I mentioned low-income subsidy. What this is, it's a state program that is designed for individuals that don't necessarily qualify for Medi-Cal, but they're maybe on a low or a fixed income. What I would do is invite you to go on to the website ssa.com, and you want to take a look for a link that says extra help or low income subsidy. Take a look at what the guidelines are for income. Even if you're over the income criteria a little bit, I would invite you to fill out the application because they might not include everything that maybe you would include in your income. If you qualify, they will notify you, and then for the remainder of that calendar year, you're going to pay $0 to $3.95 or for generics, and $0 to $9.85 for name brand prescriptions. So even if you think you might be close to those levels, I would suggest that you fill that out. It can save you money on your prescription drugs. So what we're looking at here is what they call a Medigap comparison table. And they call it Medigap, or you also can hear it called Medicare Supplement. So what this is these are standardized plans that Medicare has put into place. It's for individuals that are on original Medicare, those that remember the Part A and the Part B. And then you purchase, there's a monthly premium, and you purchase an additional plan that fills in the gaps. That's why they call it Medigap. It'll fill in the gaps for what original Medicare does not cover. So in this example, if you take a look, say, at a Plan N. As you can see, if you go all the way down on the right-hand side, you can see it fills in pretty much the gaps for almost everything. A couple things I want to mention about Medicare Supplement or Medigap plans is that they are standardized. And what I mean by that is a Plan N is a Plan N, meaning if it's with Anthem Blue Cross or Blue Shield of California or Mutual of Omaha, United Healthcare, no matter what company you are with, the benefits will be exactly the same. So what you want to do is you want to look at the reputation of the company. You want to make sure you're working with a reputable company. You want to look at the monthly premium because even though the benefits are standard across all companies, each company can charge a monthly premium. It can and will go up on an annual basis. So you want to take a look at those particular items. And then if you could please focus on the box to the right. Plans C and F are only available if your Medicare eligibility date was prior to 2020. So from time to time, Medicare makes some changes to these plans. Now, if you're on a plan and they make a change, as long as you continue to pay your monthly premium, you will remain on that plan with that set of benefits. But recently they made a change, and Plan C and F are not available if your eligibility date is after 2020. So to go over that, to make it a little more clear, say I was working and it was, I turned 65 in June of 2019 and I was still working, I was on my employer plan, or maybe I was covered under my spouse's plan, and I didn't opt into Medicare when I turned 65, but I was technically eligible prior to 2020. When I decide to opt into Medicare after I retire or come off maybe my spouse's plan, because I could have gone into Medicare prior to 2020, I can then request a quote and enroll in plans C and F. So with that, we are now going to review the various lead plans from the insurance carriers that are here today. And I'm going to introduce Lauren Mullis with Anthem Blue Cross. Thank you.
All right. Hello, everyone. Good morning. I'm Lauren Mullis. I am a direct agent of Anthem Blue Cross, and today we're going to be discussing our MediBlue Select HMO plan. All right. So I want to talk about, we're going to start off with our star rating. We have a 3.5 star rating, and for this specific plan, it's a $0 premium. All right. For any primary care visits as well, that's going to be a $0 premium, and the maximum out of pocket will be $900 for this plan. Any hospital or emergency room, hospital copay is going to be $0, and we actually pride ourselves in offering an unlimited number of days in an inpatient hospital stay. All right, emergency room copay, you're looking at $90, and our ambulance copay for ground ambulance is $200. Outpatient surgery copay, $0, and for your first 20 days at a skilled nursing facility, you're also looking at a $0 copay. All right. Any X-ray or lab work, and also MRI and CT scans, you're looking at a $0 copay as well. Diagnostic testing, physical therapy, $0 copay. Urgent care, $0 copay. To discuss our prescription drug costs, Tier 1, anything generic, you're looking at a $0 copay. Tier 2, $5. Tier 3, $42. And Tier 4, $95. Once you get into Tier 5, you're looking at coinsurance rates. That's going to be a 33% coinsurance, okay? So to talk about our dental benefits, we're going to give you a $0 copay for your 2 exams, 2 cleanings, and 1 x-ray per year. For hearing aids, we offer a $0 copay for 1 exam and 1 hearing aid fitting, and then we give you a $3,000 allowance for hearing aids. For vision, you're getting 1 exam a year at a $0 copay, and we give you an $150 eyewear allowance. All right. We also partner with Silver Sneakers for our health club membership. That is complimentary to you, and it gives you access to their online classes as well as gyms across Orange County. Transportation benefit, a $0 copay for 12 one-way trips. And what's changing for AEP, and something really exciting that I want to talk about, is our extras, our essential extras. These will be effective January 1st, of course, and if you're currently an Anthem Blue Cross member, you are eligible to elect these as well if your plan provides it, all right? So for our MediBlue Select, you're allowed to choose 2. So I'm going to run through those with you. There's multiple that you can choose from. Some do need your provider's approval that you do have a chronic condition, but most of them do not. So your assistive devices, you're looking at a $500 allowance. We'll give you that for handrails, shower tools, ramps, anything that you need. Again, that is a $500 annual allowance. You can elect a health and fitness tracker where we'll send you a complimentary Fitbit so you can monitor, your fitness goals. Pest control, if you do have a chronic condition and you do want to elect this benefit, we partner with Terminix. You can choose to elect this. You can develop a plan with them, and again, that is with Terminix. If you feel that you need more than the 12 one-way trips, you can also elect our transportation benefit. So on top of the 12 one-way trips, you can get an additional 60 one-way trips per year. So if you need more than that 12, this is something I would definitely consider. We also offer in-home support. This is targeting senior companionship, loneliness. We've definitely seen that during COVID a lot. You can elect this benefit to get up to 60 hours per year. We partner with Papa Pals. They send someone to just come keep you company, help you with daily tasks, errands, anything like that at all. If you're interested in, setting up a Facebook page, you need assistance around the home, this is something I would definitely consider. With that being said, we also offer a personal home helper benefit. This will provide up to 31 visits, up to 4 hours each visit. And this will just, if you need help with 2 or more activities, if you need more than just, companionship and support, this is something I would elect. If you need help bathing, meal prepping, getting around, this is something I would highly consider. This is one of my favorites. Our exciting one is called our Flex Card. So you'll get a $500 MasterCard sent to you, and this Flex Card will allow you a $500 annual allowance to use at any vision, hearing, or dental provider. And what this can do, for example, if you're getting a specific crown that you can't find a carrier to cover, you can use that $500 to pay that for that crown. Or if you can go into Walmart and you see a pair of eyeglasses in their vision center that you like, you can go ahead and use that $500 card, all right? Healthy meals. You can get healthy meals delivered to your home. You can get up to 2 a day for up to 90 days. So if you need help cooking and you're not just really in the mood to do it anymore, this is something I would highly consider. It's a great benefit. And then lastly, our healthy groceries. So this will help you save on the cost of groceries every month. You're going to get a $50 allowance every month, and it's going to be another little card that you can use at the grocery store. We've partnered with large retailers such as Albertsons, Ralph's, Vons, and $50 is good towards any healthy food purchase such as produce, meats, dairy, stuff like that. All right, so that's what's going to be changing mainly. It's really exciting stuff coming up. So again, for this MediBlue Select, you get to choose 2 of these essential extras. They're up to you. Some do need to have, you do need to have a chronic condition for some of these, but we'll handle that with your doctor. All right, and lastly, we haven't changed our other extras. We're still keeping the PERS benefit, which is our personal emergency response system. It's a 24/7, 365 access. It doesn't have to be emergency, even though it's in the name. It's emergency and non-emergency. Just a small little device you can tuck under your shirt, mobile. It doesn't have to be connected to Wi-Fi or anything like that. It has that built-in cellular connection. It just gives you and your family peace of mind if you're running errands, going on a walk, anything like that at all. Has built-in fall detection, so God forbid you fall and go unconscious, it will pick that up as well. It's a great, great way to give you and your family peace of mind. And then lastly, our over-the-counter benefit for our MediBlue Select plan is still a $320 annual allowance. You get $80 a quarter. It does roll over quarter to quarter, not annually. And this just gives you access to CVS and Walmart for specified products that you use every day, and you don't have to pay out of pocket for these anymore. Again, $80 a quarter. You can go to CVS or Walmart on select items such as flu medications, vitamins, undergarments, you name it, and it's just going to help you out a little more. All right, so with that all being said, if you need any assistance or have any more questions, feel free to contact me. My contact information is right there, and I will be handing it off to Diana No with Blue Shield of California.
Good morning, folks. My name is Diana No. I am an independent broker, and today I am representing Blue Shield of California. My contact information is listed in the chat box, but you are welcome to give me a call if you can't see the chat box. My number is 949-226-4064. So a little bit about Blue Shield. They are a not-for-profit company based here in California. They've been servicing the Medicare market they've been servicing the market for over 80 years. Blue Shield of California offers a variety of products such as a Medicare Advantage, Medicare Supplement, as well as prescription drug plans. So what does that mean to you? We are a one-stop shop. We have a product that fits your budget and your needs, just depending on your interests. Alrighty. So Blue Shield does offer a variety of Medicare Advantage plans. If you're a Medi-Medi, if you have chronic conditions, there's a plan for you. But for today's presentation, I am going to review the Blue Shield Inspire. This is their leading plan for 2022. So if you saw this in the description box, there is a worksheet. So I'm going to go through the worksheet and then kind of give you a little bit of explanation on the different benefits. On the screen here, you do see some highlights, but I will take a deeper dive through the worksheet. The star rating for this plan is 4. There's no additional premium for this plan besides your Medicare Part B premium, okay? It's a 0 premium. As for your primary care visits and specialists, it's also 0 copay. This plan does have a maximum out-of-pocket, which is $799. That is the most you'll pay out-of-pocket for your medical expenses, which in a moment I'll go over some co-payments. Those co-payments will go towards your maximum out-of-pocket. For hospital copay, it's a 0 for unlimited days. So if you're in the hospital for 100 days, you're covered at 100% at a 0 copay. As for the emergency room, let's say you land in the emergency room, you get patched up, sent home, you have an $85 copayment. However, if you're admitted into the hospital, that copayment is waived. On this plan, we also include worldwide coverage. What does that mean? If you encounter an emergency or an urgent situation domestically or internationally, you are covered at 100%, unlimited, minus the $85 copayment for those services, okay? As for the ambulance, if you call the ambulance to pick you up to take you to the emergency room, it's a $100 copay per visit. Outpatient surgery. Let's say you have the not-so-fun colonoscopy or you need cataract surgery. So same-day type of procedures, it's a zero copay for an ambulatory surgical center. But let's say your doctor tells you you're a little high risk, you may want to have the procedure done at the hospital facility. There is a higher overhead cost when you go to the hospital, so it's a $150 copayment per service. Moving on to skilled nursing, let's say after your procedure, right? You're a bit well enough to be discharged from the hospital, but not 100% well enough to go home. You may be discharged to what's called skilled nursing. So you need extra rehab services, extra care, etc. before you go home. So the first 20 days, it's a zero copayment. But from days 21 through 100, it's a $50 copayment per day. So you might tell me, Diana, what if I end up staying there 100 days? Am I going to be subjected to $5,000 since it's $50 per day, right? My answer for you is yes and no. You are subjected to the maximum out-of-pocket, which I mentioned earlier is $799. So once you pay that for the year, you pay zero for your medical benefits, okay? Moving on to the next few items, a lot of zeros. We have your x-rays, labs, your CTs, your MRIs, PET scans, diagnostic testing, physical therapy, speech therapy, occupational therapy, as well as urgent care. They're all zero, so you don't pay any co-payments for those services. Moving along to prescription drug coverage. So on Blue Shield, they have a very strong formulary listing of covered medications, and depending what medications you take will determine what your co-payments are. So as I mentioned, as an independent broker, that's where I come in. I help you run an analysis and let you know what plan options are best for you, all right? So I'm going to share with you the co-payments for the different tiers. I'm going to give you the 30-day supply as well as the 90-day supply. So for these co-payments, they are for the preferred pharmacies such as Costco, CVS, Walmart, Save-Ons, etc. Okay? So for Tier 1, it's generic, the preferred generics. It's a zero copay for both 30-day and 90-day. For Tier 2 is the generics as well. It's $3 and $4.50 for the 90-day. Tier 3, typically your brand names, right? So these are your Eliquis, sometimes your insulin. They fall under Tier 3. Your copayment will be $35 for a 30-day and $87.50 for a 90-day. Moving on to Tier 4, preferred medications, $95 for a 30-day and $237.50 for a 90-day. And lastly, Tier 5. These are typically your injectables, right? It's a 33% co-insurance. There's no Tier 6 on this plan. For the next item, for your dental coverage, this plan does include dental coverage. Preventive services is included, so your x-rays, cleanings, exam included, but there is an option to upgrade for a PPO plan. So if you don't want to use the network doctors on the covered embedded benefits, you have the option to upgrade for a PPO plan. Hearing aids is also included. The exam is zero, and if it's determined that you do need a hearing aid, Blue Shield offers two different hearing aid types. There's the Silver Technology, which is running about $449 per ear, right? Or if you want the premium, higher level, it is offered through the Gold Technology, which is $699 per ear. And the vendor that Blue Shield uses is called Epic Hearing. As for vision coverage, so this is for your glasses, your contacts, not your ophthalmologist. This is your optometrist, right? So you get the nice little Pradas or Burberry glasses, frames, etc. The Vision Service Administrator is called VSP. You may have heard VSP when you were working. They're one of the larger companies available for vision coverage. For your vision exam, it's a zero copay, and then you get a $200 allowance to use towards your frames or contact lenses. Health Membership Club. Yes, this plan does include health membership through Silver Sneakers. You may have heard of Silver Sneakers. They work with the major gyms in the area, like LA Fitness, 24 Hour Fitness, YMCA. And you can belong to all those gyms if you're part of the Silver Sneakers program, right? So let's say you like the gym, let's say you like 24 Hour Fitness because they have extended hours. But you also like LA Fitness because they have better equipment, maybe a better sauna, better lap pool, right? You can belong to all the gyms. You don't have to be locked into one. As for transportation, this plan also includes it, 32 one-way trips, If you need a ride to the doctor, the pharmacy, urgent care, lab, etc., this plan includes it. And then moving on to the last part, the extras, right? A lot of extras. This plan does include a medical alert device. So in the past, you've heard the commercial, "Help, I've fallen, I can't get up." That's the device I'm referring to. So it's also known as a personal emergency response system. It's included in the plan at no cost to you. You just call in and redeem the benefit. And depending on your lifestyle, your activity level, will determine which device you get, right? Whether the traditional pendant, the watch, or the GPS mobile device. That benefit is through LifeStation. If you like getting acupuncture or chiropractic services, this plan also includes that at a zero copayment. You receive 24 visits per service, so you get 24 acupuncture as well as 24 chiropractic visits. It is through a network called American Specialty Health. This plan also includes over-the-counter, right? Great items. You can order things like cotton swab, cough drops, ibuprofen, vitamins. I ordered for my parents. You receive $100 per quarter, and it's through CVS. Super easy peasy. You can either order online or over the phone. And lastly, this plan also includes home delivery meals upon discharge from the hospital or skilled nursing. So life happens, you're discharged from the hospital or skilled nursing, and it takes a little while for you to get back on track to your regular routine. This plan offers home delivery meals. So you get, I want to say 22 meals per visit or per discharge, as well as snacks, and it's through a company called LifeSpring. As I mentioned earlier, Blue Shield does offer a variety of products, Medicare supplements as well. So their rates are extremely competitive for the Plan G or Plan G Extra, so definitely give me a call if you have any questions. So for more information on the Inspire plan, Medicare supplement, or prescription drug plans, you're welcome to give me a call. Once again, my number is 949-226-4064. Thank you again, and I look forward to connecting with you guys after the presentation. Bye. Oh, before I transition over, I am going to introduce my associates, Joanne Bidet with Scan Health Plan. Thank you.
Good morning, everyone. Thanks for joining us. My name is Joanne Boudet. I work for Scan Health Plan. I am an actual employee of Scan, so I work directly with them. Scan's been in business for almost 45 years. We are a not-for-profit organization. That's important because if we start making profits, guess what? We put them back into our benefits, and that gives it back to our membership. We are local. We're here in Long Beach. We have a member service department that works from 8 in the morning to 8 o'clock at night. They actually answer their phone. You don't have to push any buttons. And then you also get me, okay? So if you enroll with me with Scan Health Plan, I will be your agent of record. And you can call me 24/7, but I only answer the phone until about 8 o'clock at night. But you can call me and I'll give you a call back. And I've been doing this for over almost 30 years. And if I don't know the answer, I definitely know where to get the answer if you've got something that's come up that we need to get resolved. But I'm a great resource for you, so please take advantage of that, considering I've been doing this for so long that I actually am one now with my the gray hair, and I've actually joined Scan myself, so I'm a Scan member as well. So today we have many plans. We have plans that are designed for diabetics where we give your insulin for a zero copay, and that zero copay for insulin even falls into the donut hole. If you're in the donut hole, the insulin is still going to remain zero. We have plans that are designed for people on low income. We have plans that are designed for folks with heart condition. And then we have our regular plan. It's been around for almost 45 years. It's called our Classic Plan. But today I'm going to introduce a new plan that's starting in 2022. We're very excited about it. It's called the Venture Plan. The Venture Plan is going to give you a give back of $125 towards your Part B premium. And how that works is that it goes, what we do is we give that application over to Medicare. Medicare gives it to Social Security, and then Social Security will change your deduction for your Part B by $125. Well, what that means to you is that your Social Security check will be increased by $1,500 a year. It's an amazing benefit, okay? So with the Venture Plan, we are a 4.5-star rated plan. 4.5 stars, we've had it for 5 consecutive years. We're very proud of that because it's not an easy task to get or to keep. Our give back, like I said, is $125 a month. Our primary care and specialist is a 0 copay. Maximum out of pocket is $1,000. So if you were to reach a maximum out of pocket for your Part A and B where you're paying copays, you're still $500 ahead with that give back plan. So I just wanted to point that out. Hospital copay, 0. Emergency room is $90. However, it is waived if you are hospitalized. And an ambulance is $155. We cover you worldwide for emergencies and urgencies. So if you're anywhere in the world, we're going to cover you. There's no maximum of coverage. It just has to be emergency or urgency. That even includes seeing the cruise ship, the doctor on the cruise ship, or if you're out of state, out of the county, or out of the country. Outpatient surgery, we covered that, and usually most of it's done at a surgical center. If you have an outpatient surgery, which could be cataract surgery, they could be hernias, gallbladders. If they're done at an outpatient surgical center with our numerous medical groups that we contract with, you're going to pay nothing. If that outpatient surgery is conducted at a hospital, then it'll be a $225 copay. Skilled nursing, you don't pay for the first 20 days. Skilled nursing is what us baby boomers changed the name to rehab. The doctor says at the hospital that you don't have to stay here anymore, but you will have to go to rehab for a little bit. We're going to cover the first 20 days. If you stay longer than 20 days, then you're going to pay $100 a day. But don't forget, you have that maximum out of pocket of $1,000, so you'll never spend more than that in 2022 for your Part A or B copays. The next is X-rays and labs. Those are all 0. MRIs and CT scans are $75 copay. Diagnostic testing is, this is like radiation treatment. It would be a 20% copay. But again, we've got that maximum out of pocket of $1,000. Physical therapy, $5. Urgent care is 0, and again, worldwide. And our prescriptions, we have 5 tiers at SCAN. So our tier 1 is going to be a 0 copay. You can get it 3 different ways. You can go to a preferred pharmacy, you can go to a standard pharmacy, or you can use our mail order, which is Express Scripts. And the mail order is going to automatically give you, automatically give you a 3-month supply. And with SCAN, your doctor can request that 3 months be 100 days. Of medication, or a supply for 100 days. So you can get a 30-day supply at a preferred pharmacy, which would be CVS, Rite Aid. You can go to Costco. You can go to Vons, Albertsons, quite a few of them. Our standard pharmacy is going to be Walgreens. It's going to be Medicine Shop and some smaller ones. You can still use a Walgreens or Medicine Shop, but you're going to pay about $5 to $15 more for your prescription. We offer you a 30-day supply or a 90-day supply at the pharmacy. On your Tier 1, it's a 0 copay either way. Tier 2 is also, this coming up year for all of our plans, is going to be a 0 copay. And that's the same 90 days or 30 day. Tier 3 is a $30 copay and a $70 copay for a 90 day. And Tier 4 is $95 for 1 month, or you'd pay $265 for a 3-month supply. And Tier 5 is a 33% copay. Dental, we cover you for a full dental on this plan, and it would be at a discounted rate, so the cleanings and the x-rays and even deep cleanings are 0 copay, And then you would get anywhere from a 30 to 60% discount on the larger comprehensive dental things like crowns and root canals. Hearing aids, we use True Hearing. You would pay $450 or $750 for that hearing aid. Vision is called iMed, and there's no charge for the exam, and we would pay $250 allowance on your frame. So you could spend $250 on your frame, on your lenses, or even on contact lenses. Health club membership, it is I'm so sorry. The health club membership is also included. You can get transportation. It's 24 one way. And then our extra benefits are we give you podiatry visits for no charge, acupuncture and chiropractor no charge. We give you a Fitbit to help you exercise a little bit, do some more walking. We have over-the-counter, $100 you can spend over-the-counter in a catalog with Scan. We want you to spend our money, not yours, so $100 would get rolled over. If you forget the first quarter, then it's going to roll over to the next quarter. You have $200. It'll continue to roll over till the end of the year. We also cover you for returning to home. This one I think is really special. If you come home from the hospital, you need a little extra help you need a little extra help at home. If you go home and you try to do the things you normally do, like changing the linens on your bed and your laundry and things like that, then what we can do is bring somebody out and they can come in and they can do those things for you up to 40 hours, and that would be in 4-hour increments. And then that also includes 28 days worth of food delivered to the house. So that would be 84 meals. As I said, you get me as your agent, and so I'm here to help you. So my phone number is 714-272-8983, 714-272-8983. Please give me a call. I can go over that give back of $125 and answer any of your other questions. Now I would like to introduce Rosalie. She's from United Healthcare. Thank you.
Good morning. Hi, my name is Rosalie Pulio, and I'm with United Healthcare. I'm a broker with United Healthcare. My number is 714-292-3796. I always like to give that just in case you have questions after this meeting and you want to learn more about the product. This year has been a great year for United Healthcare, and they've really added some benefits to what we are offering this year. And one thing about United Healthcare, just a little bit of background, they are a Fortune 5 company this year again, and they have the most Medicare Advantage members in Orange County, so that's pretty exciting. Okay, so I'm going to go over the benefits, and again, afterwards, if you have questions about any of them, please feel free to call me, and I'm happy to help you. So this year is a 4-star rating, and of course, it's a 0 premium, and just like most all the other plans, 0 copay for primary care, specialist care, all of those other visits, and also virtual visits. Now, maximum out-of-pocket for this year is $800, which is down from $200 from last year. And then hospital copay, that is going to be unlimited amount of days for 0 copay as well. Emergency room copay. So if you go to the hospital and you go to the emergency room and you leave from the emergency room, that's going to be $90. But then if you are admitted from there, then of course then it's going to be waived, okay? And let's see, so ambulance. Here's another reduction in some costs for this year. Last year was $225. This year is $130 for ambulance. And I always tell my clients, make sure you call the city and make sure that you check to see if they have a paramedic program, because that's only $5 a month for the entire household, and it covers, whenever you need to have an ambulance call, and then you don't have to pay your $130 fee. Also, this ambulance is for air, land, or sea. So if you're on a cruise and you need to be airlifted off of that cruise ship, that's all you're going to be paying. And as I go through these benefits, I want to make sure that you understand that all of these medical benefits are worldwide. So if you went to Europe and you got sick, you would have zero copay. You would pay it and bring the bill back, and United Healthcare would reimburse you. So just so that you know that. Okay, let's go on to outpatient surgery. So zero copay, whether it's in the hospital or it's in an outpatient facility. And that makes a difference because sometimes there are additional charges with some plans. Okay, nursing facility. All right, the skilled nursing. First 20 days are zero copay, but then the next 7 days is $100 a day, which will go towards your out-of-pocket maximum. And then days 29 through 100, again, is going to be zero copay. So out of 100 days, you're paying for 7, which is great. Labs and x-rays are all zero, and MRI CT scans going to be zero copay. Once again, another additional benefit. Diagnostic testing, the non-radiological, are all zero copay. Now, physical therapy, speech therapy, occupational therapy, zero copay. Urgent care. If you go to the urgent care within your network, then that's going to be zero. Okay? If you go outside of your network, say you're in Bakersfield and you need to go to urgent care, then all you would do is just go to urgent care and you would pay $20 copay. But again, worldwide urgent care is going to be zero, which is a great benefit. Now let's talk about the medications for this year. Tier 1 and Tier 2, whether it be 30 days or 100 days, is going to be zero copay. And then Tier 3, here's another reduction in cost. Tier 3, which is the brand drugs, reduced down to $35 for 30 days or $95 for 100 days, and that's a big reduction. Insulin. If you're insulin dependent, then it's $35, and that would cover you at $35 a month, even within the gap. All right. And then Tier 4 is $100 for 30 days or $290 for 90 days, or 100 days, excuse me. And Tier 5 is 33%. And let's see. So let's talk about some of the extras. So for the dental coverage, we give you up to 3 cleanings a year, and that includes fluoride and x-rays, et cetera. This year they've added $500 comprehensive benefit, and we also have a PPO buy-up, and that gives you $1,500 worth of benefit for the year. Hearing aids, the cost went down from $375 $2,000 to $375 to $1,425. Vision, this is a great benefit, $300 for frames, and the lenses are free, or contacts. Renew Active is the health club membership, and you can go to most any of the gyms around. They also give you a wellness program where they reimburse you for some of the things that you've accomplished. Transportation is 24 one-way rides, which is great. Some of the extras are chiropractic and acupuncture for this year, 20 visits at zero copay, and then $50 for over-the-counter products. So those over-the-counter products, you're going to get a catalog that looks like this, and you can pick whatever you want, but if you don't use it, you lose it. So make sure you use it. We have the personal emergency response system. We have podiatry, a non-referral. You can just go twice a year for routine visits. And then we have a concierge service. It's called Navigate for Me. So if you've been diagnosed with a chronic illness or severe illness or surgery or cancer or something, they do have a service that will help you facilitate your care, which is wonderful. You know, United Healthcare also has a chronic plan for diabetes and for heart disease. They also have Medicare supplement. And the Medicare supplement is, you know, A through N, and they also have 3 RX plans to go along with that. So again, my name is Rosalie Pulio, and I'm local right here in Orange County, and I'm more than happy to help you with anything I can or any questions that you have about the plan. And again, my number is 292-3796, and I look forward to hearing from you. Thank you. And now I'm going to introduce you back to Henry. Thanks.
Okay, I'm back. Well, I want to first off thank everybody that's presented today, all the agents, Jeanette, representing and giving an overview of Medicare. Just want to thank you for taking time out of your Saturday morning to spend with us and let us share with you some of this information. There is a lot of information. During the chat, the phone numbers of the representatives were listed in the chat. You can also go to the links on YouTube and pull down the presentations or the comparison charts. And if you'd like, look on our Hoag website, and you can sign up for other events. If you didn't get everything you wanted today, we have many events going on, open enrollment period, and feel free to look on our site and sign up for another class. We hope that you join us again, and more importantly, we hope that you have a great weekend. Hopefully it's drying up outside. Enjoy the weekend and be safe out there. Thank you very much again. We really appreciate your participation and attendance. Thank you.